So let's talk about Medicare Advantage plans. We will review everything that you need to know about Medicare Advantage plans, including some pro tips to look out for if you are considering a Medicare Advantage plan. So stay tuned. My name is Crystal Armand, and I am a licensed life and health insurance broker, and I run an insurance agency out of Miami, Florida. My team specializes in bringing access to healthcare to everyone in our community. We specialize in Medicare, Obamacare, and discount plan alternatives for those who do not qualify for traditional health insurance programs. As a Medicare specialist, we help seniors in Florida to navigate the complicated world of Medicare and to find the best plans to meet their needs. So let's go ahead and dive into Medicare Advantage plans. It can be kind of tricky to understand what exactly Medicare Advantage plans are and how they work, and more importantly, to help you decide if a Medicare Advantage plan is the right solution for you. So today we will review all that you need to know to make a more informed decision about your Medicare Advantage, your Medicare coverage. And at the end of the video, we will discuss some of the most frequently asked Medicare questions. Maybe you have seen some Medicare Advantage ads on television, and many of these ads can be vague. So today I really want to cut through the clutter and just get down to the most essential points of Medicare Advantage so that you really understand what they are and how they work. So let's jump into what are exactly Medicare Advantage plans. In short, Medicare Advantage plans are an alternative way to receive your Medicare coverage. They are not traditional Medicare, but rather they are plans administered by private insurance companies that Medicare has approved. And they have approved them to bundle the benefits of Medicare Part A, Part B, and Part D, which is usually the prescription drug coverage, into one single plan that offers everything. So you have to be enrolled in Medicare Part A and Part B, and you have to be paying the Medicare Part B premiums of $148.50 per month in order to be eligible for the Medicare Advantage plans. But once you do get enrolled, you no longer use that little red, blue, and white card that, original Medicare sends you. You are part of a specific plan with a specific insurance company. They set their own copays, their own coinsurance, their own cost shares, and that you're responsible for paying when you're enrolled in the plan. There's always a little portion that you have to pay out of pocket, but they also establish a maximum out-of-pocket limit, which is much lower than if you have Medicare, original Medicare. So there are different types of plan inside of the Medicare Advantage plans. You have the HMO plans and the PPO plans. I'm gonna talk today only about the two most popular plans, which are the HMO and the PPO plans. And I'm gonna explain what the difference is. When you are in an HMO plan, you're required to use in-network doctors and hospitals. So there isn't any out-of-network coverage unless it's a real emergency. An HMO will require you to establish a primary care physician who you will have to seek referral from in order to see a specialist. When you're in a PPO plan, you don't necessarily need to have established a primary care physician as your physician, and you don't need to get referrals every time you need to go and see a specialist. And so you can go out of network, even though going out of network will be a little bit more expensive. So Medicare Advantage plans will have a certain doctors that take their plan every year, and it changes from year to year. And in the middle of the plan, you might have a doctor that might drop out for any reason. So keep that in mind, because once you're in a plan, you will have to stick to the doctors that are within the network that plan offers. So when you go to the doctor or hospital, when you have a Medicare Advantage plan, you will give to them your Medicare Advantage card. And your provider is the one that's going to bill the plan. Once Medicare Advantage approves the claim, you will be charged the copays, the amount that's really must come from out of your pocket. Additionally, some plans will require maybe some prior authorization for certain services. This is generally for the big operations, the things that are very costly. And so this is something they look at to really contain the cost and make sure there's not too much waste. So if you've watched TV, especially in the fall, you've certainly seen ads of Medicare plans that are saying that it's free or $0 per month. And a lot of people want to know, how do they do that? Well, the reason they can do that is because these companies really get money from the federal government, which pays them to really serve you as a Medicare patient. And because they get that money for the insurance company, they don't seek any additional money from you. And they can even bundle in additional benefits like vision and dental coverage, even though it's limited, but it's still more than what you get under original Medicare. However, the cost of these programs and the availability of these programs really varies from state to state, county to county. In some parts of the country, you might find dozens of Medicare Advantage plans available at $0, and in other parts of the country, you might not find any. The good thing, I'm out of Florida, and in Florida and Miami-Dade, Broward, you'll find plenty of plans that are at $0. You can call us if you need more information about that. One of the first questions that I get is, when can I change my Medicare Advantage plan if I don't like the plan I'm in? Well, Medicare gives you an annual election period between October 15th and December 7th, where you can sign up for a new plan. You can change plans. Maybe you had a supplement, now you're getting into the Advantage plan model. And they also give you additionally between January and March 31st to change. If you're already inside of a plan and you want to just switch plans because it no longer suits your needs, you have that election period that you can turn to change plans. So you're not stuck to it for the rest of your life. Another question I get is in regards to the prescription drug coverage offered through Medicare Advantage plans. Some people know of the other plans, the supplements, where they pay to get a Medicare Part D, which is the prescription drugs, in addition to Part A and Part B. Part B being the physicians and specialist care, the out of I would say outpatient services. So the good news is when you do get a Medicare Advantage plan, it is similar. You get that similar prescription drug coverage. So the only thing is that each plan has a different formulary. What they mean is that each plan accepts different kind of prescription drugs, and it's very important to see if the prescription drugs that you take are covered under which plan. So that's where we come in and we help you figure out which plan is best suited for your needs. So one of the things that Medicare Advantage plans heavily advertise is really the fact that they offer free dental coverage, and a lot of people get very curious, and this is how really they will sign up and choose to go with those Medicare Advantage plans. And I can tell you from experience that the HMO plans typically offer a greater coverage because the doctors are inside the network, so they have a deal with the insurance companies, and that allows them to save costs, and then they can offer you more benefits. The PPO coverage usually is more limited. So you might get only routine cleanings once or twice a year. So, and they have a smaller dollar limit to what you can spend under this dental benefit. So if you would need more information to see what's available in your area, and if this is something that if we can find you a plan and tell you what is available, we're happy to give you a free consultation and answer all your questions when it comes to Medicare and Medicare Advantage. I hope that this video was useful, that you found a lot of information, and that we answered many questions. If there are other questions you would like us to answer, please include it in the comments below. Like the video, share it with your friends, subscribe, and we will, so that you know every time we have new videos coming out, so that you have all the information you need, so that you can take the best decision that is the best for you. It was great being with you, and I hope to see you again on our channel very soon.